And oh my God, poor Mary over there, she's even worse off.
Right.
You know?
And the best part about it is, especially if it's a support group that runs for a long period of time, you know, you come in sort of as the newbie and you look at the people who've been there a while and you can say, that's where I'm going.
Uh-huh. Hello, this is Joe. And who is Joe?
Joe is my fiance.
Okay.
I don't want to interrupt.
He wants, he's not interrupting. Go ahead, you have a question, Joe.
Something I've always wanted to know, and I guess we haven't been intimate enough to talk about it. I'm curious, in my older life of 41, I have only lost 3, very important people, my 3 grandparents of my 4. My grandmother is still alive and is in the hospital, but she'll be okay, I think. She's 92.
Wow, God bless.
But at this older age in life, am I going to just be a basket case when I lose everybody else?
Good question, Joe.
I mean, one after another, when...
Multiple losses are always harder because you don't get a chance to finish grieving one before you have to start grieving another. But I think part of it is you learn that you're more resilient than you think you are. You hurt and you cry and you rage, but you get up and you do it all again tomorrow. So I haven't lost anybody yet. And I know that you learn things about yourself when you suffer that make you stronger. And anytime you miss the people you love, especially those that are closest to you, parents, grandparents, the best thing about it is that all you need to do to find them again is look in the mirror, and they're staring right back at you.
Probably, yeah, sure.
Because you have their eyes, or you have their smile, or you look just like them. And so sometimes that helps when you're really missing somebody. So as difficult as multiple losses are going to be, you find the strength. And you get up again tomorrow and you become a better person because of it.
I'm sure you'll help me through it.
I'll
I'm
hold
sure
your
you
hand
will.
every step of the way, I promise.
Thank you.
I did lose 3 people in the course of 7 months that were close to me. First was my friend Frank. Then that was December of 2010. April of 2011, my sister-in-law passed. She had breast cancer. And she passed. She passed 4 days after her eldest son got married. She waited for that wedding, and then she went in right after that. Okay. And then my very close friend, another elderly, I have a lot of elderly lady friends, and she passed away, and I was away when I got the news of her. So, I mean, 3 very close people to my heart inside of 7 months was not easy to handle.
No.
And somehow we get through, but like you said, you're just getting through, or you're not even getting through. You're still in the midst of grieving for one person, and then somebody else goes, and then you're grieving for 2 people, and then somebody else goes, and that's a heavy load.
Yeah, the trick to that is you got to compartmentalize. If you try to just grieve with a capital G, you get completely overwhelmed and you start worrying that you're grieving too much for one and not enough for another, and then you start feeling guilty that you're not giving this one their due. So a lot of times I say to people, all right, so create a schedule. If I cry today, I'm crying for Mary. If it's tomorrow, all right, then that's all Bill, And so it gives you a chance to feel like you're grieving for everyone, because otherwise you're just constantly grieving and you don't know who you're crying for.
After a while, it's just a big mishmash.
Right. But if you give yourself time and sit back even when you're grieving and think about, who am I doing this for? What is today? What was it that triggered it? And it then gives you a chance to filter it into those memories and that grief. And it doesn't make it feel like such a mishmash.
Yeah. So in other words, you have to really put it in your head. Today, right now, I'm crying, and I have to answer the question, why am I crying? Well, I'm crying because so-and-so is not here anymore.
Right. And then that's it. And don't let it be a springboard. Say, I'm crying because, I heard this song on the radio, and it made me think of this person, and that's who I'm crying for. Oh, but wait, I've got to remember to cry for this one and this one. Stop after, this is who I'm crying for today. And give yourself permission to just grieve one person at a time. Don't worry. The thing about grief is it'll wait. It'll be there. Don't worry. So you don't have to worry about not giving all those other people their due. But the fact of the matter is you can't grieve multiple losses all at once.
Huh.
It'll
That would
overwhelm
be
you.
too much, yeah.
Yeah, and then you can't function and you're no good to anyone.
Mm-hmm. Yeah. Yeah, that's true. That's true. I guess so, yeah, because, I mean, I know that there were days when I just didn't even, there were days I was just crying and crying and couldn't even answer the question, why? Why am I crying? Who are you crying for today? What, and
Yeah.
it's very hard to sort it all out, I guess.
Especially in the very beginning stages, yes, all you're going to do is cry. Because in the beginning, all you do is feel.
Yeah,
That's it. Your entire existence is just one long emotion.
yeah,
And once that starts to dissipate, then your head kind of kicks in and says, okay, what do I sort of need to do? But you have to allow yourself to get through the feeling first, because otherwise you can't think.
right, yeah, you have to feel the emotion.
Yes.
Yes, and in order to be able to release it, you have to experience it.
Most definitely. Yeah. And you have to allow yourself to experience it.
Yeah,
When you feel it, where you feel it. And it's not always the most convenient thing. It would be wonderful if you could say, oh, well, it only happens in my house late at night when I'm alone. You can be standing in the middle of ShopRite, and a song comes over the PA system
yeah.
and you're a basket case. You can be anywhere. Anything can trigger it. And so it's just giving yourself permission and not worrying about who's judging you and who's looking at you. Because if they're judging, well, then they haven't experienced a loss, or they wouldn't judge.
right, right. Yeah, it's the truth because, I've had people say, oh, stop crying now, that's enough. Yeah, you can't tell a person who's grieving, stop crying now, that's enough. I don't want to hear it anymore, or,
Get
just
over it.
Get over
That's
it.
my
That's
favorite.
three words that nobody wants to hear, get over it.
I'm not going to, so you get over that.
Get over the fact that I'm not getting over it.
Right. I can't. You're never
Right.
going to get over it. But that's the thing. You just have to let people grieve. Now, if, we're talking about concentrated grief for several months or several years where they're not getting out of bed, they're not functioning in their life anymore.
No, that's bad.
Then, we'd come in and we'd recommend something more significant than, say, a support group or just your friends around you.
Maybe seeing a doctor for some drugs or something.
Right. Sometimes what winds up happening is you discover that there's a pre-existing condition that the grief sort of flipped.
Really?
Someone who may have had, depressive tendencies, that it just slams
Just
them and
put them right over the top.
right. And so sometimes, even as a grief counselor, you have to know when your help isn't enough, and when you might need to refer them to someone who can help better than you can, or in addition to what you can do.
Right, right. Yeah, sometimes a little medication plus the counseling
Right.
is what they need.
Right. Or sometimes it's addressing another life issue that's not about the grief that's complicating their grieving.
Wow, yeah.
A bad marriage, the job that they hate. Everything sort of comes together. And sometimes if you fix one problem, it's like a little domino effect and you fix everything else.
Oh, that's good. That's good that can happen.
You can.
That's wonderful. Yeah, yeah, because then then they get over it, I guess.
You go on. You never get over it, you go on.
That's true. You go on, you move on, you remember,
Yeah.
and you just keep going because life goes on.
Yeah, and that's one of the hardest things. Your world stops, but the rest of the world keeps going.
Yeah.
And in the beginning, that is the worst possible thing you can imagine, because the world ought to stop because yours did, and it doesn't. And so you have to find a new place in the world with the new person you've become, because you can't go backwards. You're never going to be the person you were when that person was
No,
alive.
you'll never be the same.
No, and so you have to become the person you are right now,
Right.
the person who lost someone, and not try to move backwards, but go on and move forward.
You have to move forward. That's the only place to go.
Exactly.
If you go backwards, then you're only hurting yourself. And you have to be strong enough to keep going, taking, as you said before, one day at a time. Get through that day, and then get through the next and the next, and it gets a little easier as you go on.
Absolutely, and don't be afraid to ask for help. And even if it's not going to a support group or seeing a counselor, even if it's, you know what, I can't pick the kids up from soccer practice. Could you go get them? I'm having a bad day. I just can't think about doing that now. Could you do that?
That happens.
Yeah.
That happens. It really does. So in the meantime, this is a very interesting conversation about death and dying. It has, you've been very informative, and you've also given me a lot of insights that I didn't have before, even though I have experienced loss on many occasions, many times over with people and pets and things like that. And I thank you for being here.
Thank you so much. I had a wonderful time.
Yeah, I'm glad you did, and I had a very nice time having you, and good luck to you. You want to just say one more time, just tell everybody how to reach you. Go ahead, about your website,
Yeah, you can either go through sigriefcenter.org for the Staten Island Grief Center. That is just starting to get up and running. Or you can contact me through St. Joseph St. Thomas Parish, the Little Angels program.
Very good. Thank you so much.
Thank you.
Okay, take care.
Thank you very much.
Thank you. Good night, everybody.